morning, board and executive leadership. How is everyone today? Well, I'm here to talk about some exciting news. Today, we're going to present a comprehensive strategic turnaround plan for Henry Ford Health System. Recently, we've had challenges with labor friction, data privacy litigation, and public relations pressure. And we have tested our operations. But this plan aims to stabilize the workforce, secure digital infrastructure, and protect margins, and rebuild public trust, which is something that is very important. What I come to do today is I'll outline how we'll systematically stabilize our workforce, secure our digital infrastructure, protect margins, and rebuild trust in our communities. Well, let's start with how we're going to ground. Let's start with the background of Henry Ford Health System. Henry Ford is a massive $13.1 billion healthcare provider that anchors 13 hospitals and employs 50,000 people. Despite our scale and high net income of $543.5 million, our rapid growth has compressed our operating margin to a thin 1%. This means we have zero room for operational waste, prolonged strikes, or legal penalties. To protect this margin, our cultural mission must evolve from transactional management to proactive employee advocacy, ensuring our frontline workers are supported to deliver safe, high-value patient care. Because without proper patient care, how will we thrive, right? So our priority is resolving internal labor disputes, especially the most recent friction at Henry Ford Genesis. While external legal challenges are dismissed, the damage to morale and return to work terms require immediate attention. We're implementing a formal internal buy-in strategy that includes a tri-party neutral dispute resolution boards to handle scheduling and position complaints, clinician-led staffing committees, also for nurses to vote on workload structures, and continuous proactive stay interviews to catch frontline burnout. So with more staff, having nurses to vote on workload structures, because they're the ones who's actually working the shift, and to have work with the third party to dispute resolution boards to handle scheduling and position the complaints to where it's not such a heavy workload. I feel like would help staffing. What do you guys think? Also, we want to tackle patient privacy. To ensure patient privacy, we're permanently insulated the system from litigation, past class actions such as the $12.2 billion website pixel tracking settlement and the phishing data breach that exposed vulnerabilities in the handling of consumer data, which is a big no-no. To fix this, we've removed unverified client-side tracking scripts from patient portals and replaced them with secure server-side data analytics. No third-party tech vendor will interface with our systems without a strict, legal binding business associate agreement. So, because we need to build trust, and building trust starts with trusting or picking closely with who we use and who has access to our data, right? We've also deployed phishing-resistant multi-factor authentication across all 50,000 employee accounts to prevent data breaching or digital breaching. So just having a more secure system, I feel, will help with data breaches and phishing in the future, because that's scary. No one wants their information all out in the open. I know I would not. Even though we can't resolve all systematic challenges alone, our strategic partnerships help offset overhead and build resilience. The Ascension joint venture spreads our compliance costs. The Henry Ford Michigan State University Alliance embeds medical students in our clinical rotations early to feed our talent pipeline and to curb nursing shortages. So our elite global partnership with Bayer AG brings advanced experimental trials to Detroit, elevating our clinical brand. Lastly, our partnership with AHSA implements our automated workforce system that optimizes shift fill rates and reduces clinical burnout. Because, like we emphasized before, clinical burnout is very important. You know, if our patients and clinicians are burned out, then that'll affect the longevity and reputation of the healthcare system, which is not good. So with these strategic partnerships, they support our aggressive hiring goals, which include high cost temporary travel nursing constraints, strain our thin margins. So over the next 24 months, we aim to reduce travel agency labor costs by 40% and convert those funds into permanent internal positions. So we're offering targeted sign-on and retention bonuses of up to $10,000 for midnight shift and acute care RNs. So as of our new 20-story destination, Grand Tower nears completion, we plan to onboard over 1,200 clinical specialists, and additionally, we're expanding our internal cyber and legal compliance workforce by 15% annually to ensure data security is in its entirety in-house. So even though nursing contracts benefit the nurse or the employee, we have to also find ways how we can benefit our system inwardly instead of outwardly. So nothing against the patient, the nurses who are travel nurses, but this is just a plan to help the betterment of all employees. So also, to counter past PR challenges, our external narrative must emphasize community impact and transparency. Our strategy centers on $604 million community benefits agreement tied to our Detroit expansion. We collaborate with the volunteer neighborhood. Currently, it's called Neighborhood Advisory Council to ensure residents have a direct voice in how developmental funds are used, including building green spaces and reserving 20% of new local housing for affordable options. We've also launched Populance, a nonprofit focused on secure, non-commercialized public health tracking, because providing patient care is our priority. So how do we fund these initiatives while maintaining our slim margins? Good answer. I would start with, we adopt a strict blended capital strategy. Our $2.7 billion 5-year CapEx plan is well protected. For instance, the new towers rehabilitation floors are covered by a $375 million gift from the Gilbert Family Foundation, which we're really grateful for, and a $700 million for structured municipal bonds. Operationally, we're consolidating our 13 hospital network into a single secure Epic EMR platform, reducing software audit costs and preventing privacy breaches. By integrating legacy facilities into our unified supply chain, we aim to save $250 million in total operations. To execute this safely, we mapped our plan across a 3-phase timeline. Months 1 through 6 focus on stabilization, signing return to work terms with unions and validating web data security. months 7 through 18, shift to system integrations, launching unified EMR data migrations, setting up joint scheduling committees, and capturing supply chain savings. Finally, months 19 through 36 will bring us to optimization, closing construction on the new tower, meeting hiring targets, and realizing projected merger savings of $250 million. So I think the goal would be to navigate a tight, well, not the goal, but navigating a tight margin requires resolving labor friction, protecting patient privacy, and expanding our clinical footprint. These are mandatory steps for survival. Unfortunately, it's not that we want to do it or we have a choice, but it's almost like we have to, like we don't have any other options. Executing this plan locks in generational loyalty and turns Henry Ford Health System into an offensive market leader. To keep the 36-month roadmap on a schedule, I request executive authorization for 3 immediate directives, reaching Q1 capital reserves for EMR migration and retention bonuses. Signing the finalized labor return treaty to stabilize frontline teams, and deploying updated IT zero trust protocols. I believe in the future of Henry Ford Health System, and I feel like if we take the steps needed, we can help Henry Ford to reach its goal of being a stabilized, unified hospital that we all can trust in. But thank you. I'll open up the floor and let me know if you have any questions. Thank you for taking the time out to listen to my strategic plan for Henry Ford Health System.